After having hip replacement surgery, using the stairs is one of the most common challenges that patients will face when they first get home after the procedure. And yes, there's definitely a wrong way to do this where if you do it incorrectly, you're going to increase your pain, but also you may slow down your recovery as you're going to irritate the hip joint even further. I'm Matt Sigwa, a doctor of physical therapy, and I've treated hundreds of patients who had a total hip replacement. And today I'm going to be explaining the correct way to go up and down stairs after having hip replacement surgery. First off, after a person is discharged from the hospital, typically they're going to be taught and shown the correct way to ambulate stairs so that they can safely perform that at home. Now, this video is specifically for anyone who just forgot the technique and want to make sure that they're doing it correctly. Or if a person just wasn't shown when they were discharged how to do the stairs, this is going to be a good overview of the safe and correct way to do it, especially in the first 2 weeks. Now, with that being said, what I like to tell a lot of my patients during the first 1 to 2 weeks is unless you absolutely have to use the stairs, you want to limit how often you're going up or down. So if you don't have to, then don't use it for that first week, just so you can let the hip joint heal a little bit more and you can reduce the amount of inflammation that may come with doing the stairs over and over. So in terms of the technique, if a person has railings on both sides and they're easily accessible, like they're both in reach, you definitely want to use both railings and hold on to them while you go up or down. Now, for the most part, most people will only have one railing on one side, or their staircase will be too wide that they can't comfortably and safely hold on to both at the same time. So the technique that I typically have patients do is one hand will be holding on the railing, so it doesn't matter which one is holding onto the railing, it could be left or right, and the other hand will be using a cane which will be on the stair itself. So it doesn't matter which one is holding which. The main thing is that you're always having both hands engaged, one hand on the railing, one hand on the cane, to give you a little bit more support and help with the weight bearing, especially on the surgical leg. Now, the more confusing part that people are unsure about is the technique of which foot goes first when you go up or down. So a general phrase that's often used to help patients remember this is up with the good, down with the bad. So what that means is the first leg that's going to step up is the non-surgical leg. So if you're going upstairs, you want to lead or step first with your non-surgical leg. Now, it's going to be the opposite when you're going down. So up with the good, down with the bad. So while you're holding the cane and the railing, when you're going down, you want to step first with the surgical leg. So up with the good, down with the bad. As long as you're able to remember that phrase, that's going to tell you which foot to lead with. In terms of the sequence of when to put the cane down, this is very important, and some people will do this too quickly, which can cause more discomfort when they're weight bearing on the surgical side. So while you're holding the railing, while you're holding the cane, let's say if we're going up first, right? While you're holding the railing, you want to then put the cane on the very next step where you plan to take your step up, right? So you do railing, cane will go first onto the very next step. You're not doing 2 steps at a time, just 1 step at a time. And then you'll follow the cane up with stepping with the good leg or the non-surgical leg. So then once you step up with a non-surgical leg, then the surgical leg will follow and land on that same step. So in terms of how we're doing the stairs with the steps, specifically, it's going to be what we call like a step 2 pattern. So you'll do 1 step going up with the non-surgical leg or the good leg, and then the surgical leg or the bad leg will just follow that good leg to the same step. You don't want to do the typical pattern where we alternate the steps. It's going to be 1 step at a time, and you're always going to be leading with the good leg or the non-surgical leg while you're going up. So it's going to look like up, up. So you're just copying the same step when you're bringing up your non-surgical leg. You're not alternating. Now, when you're going down, the technique in terms of the step 2 pattern is also the same. So we're not going to be alternating going up or down, because then that hip joint, the surgical hip joint, is just not ready for that amount of pressure and weight bearing. So when you're going down, it's going to be holding onto the railing. You're going to lead with the cane, so the cane will go down to the very next step, and then the first leg that's going to go down is the bad leg, right? So the surgical leg is going to go down, and then the good leg follows that same step. And then as you keep going down, it's just surgical leg, non-surgical leg, and just one step at a time. You're just following. So there, when you go up or down, there is no alternating steps. It's always one step at a time. And also, when you're doing the stairs, don't feel the need to rush. As long as you take your time, do one step at a time, you're going to notice that it's going to be very manageable. Now, when you're first trying it out, it is always best practice to have a family member or someone guarding you and very nearby to help you, one, feel comfortable, but also in case you happen to misstep or you feel like you're about to be like a fall risk, they're there to make sure that you don't fall. But the two main things that you want to remember is, one, up with the good, down with the bad, and you're doing one step at a time. There's no alternating at all when you're doing the steps, especially the first 1 to 2 weeks.